All right, Katie, I think should be good to start. Um, yeah. Okay, well, hello and welcome everyone. Thank you for attending this Wednesday webinar with us. My name is Romina. I'm a student recruitment representative at Fleming. We have Sol here from our international department. I'll let her do her introduction first, and then we'll move on to Katie, which is our amazing program coordinator for the pharmacy tech program. So yeah, let's just start off with Sol.
Thank you so much, Romina. Hello, everybody. Thank you for connecting today. I'm just going to be here if we have any international students connecting today, hopefully from the Americas, since it's the time in which they can connect. Again, I'll leave the floor to the two experts, Romina and Katie. Thank you for having us. I will drop our email address on the chat box if you have any questions relating to student visas, work permits, etc. Thank you. Enjoy.
Perfect. Thanks so much, Sol. Yeah, so I'll do a brief introduction for Katie and let her take over. So Katie is our faculty member and the program coordinator of the pharmacy technician program at Fleming. She has been teaching in the program since 2012 and has been the program coordinator since 2022. And she began her career in pharmacy at the age of 16 and brings a lifelong passion for profession to her work, particular interest in retail pharmacy and compounding. She's an elected board member of the Canadian Pharmacy Technician Educator Association, which promotes excellence in pharmacy technician education through educational standards, shared best practices, and ongoing discussion of regulatory changes. Outside of her professional role, Katie is a busy mom of two who enjoys hockey and creating lasting memories with her family. And yeah, I'll give the mic back to Katie.
Hi, everybody. Nice to meet you. Thank you, Romina, for the introduction and Saul for coming. The coordinator since 2022. So it's been a few years now that I've been able to coordinate the program. We do have some changes that we have looked into making, but basically we will be discussing how the program runs at this point. And hopefully, if there's any questions, then you guys can reach out and let me know if you have any. It is a two-year program. So your first 2 semesters is really getting to know the courses and making sure that you're ready when we get into the hands-on aspect of the course. So when we get into the hands-on, you will be doing compounding. We do sterile techniques. So I'm not sure if any of you guys have seen hospitals or looked into pharmacy in hospitals, but we do TPNs. You'll learn about the math for all of those, working in a sterile environment and a non-sterile environment in pharmacy. And we do compounding. So when you guys need to get a medication compounded, sometimes like a tablet, if you can't swallow it, then we've made it into, a lozenge or lollipops. And we actually have all of that stuff in the labs. So you can make lozenges and lollipops and all of that fun stuff as well. In the hospital settings, we have a really cool lab, which I'm going to show you once our presentation comes up. And this lab has 4 hoods in it. So you actually learn how to sterile compound in the hoods, which is really cool. So I will get you all of those pictures as well. In your first 2 semesters, we do have a few courses that are a little bit harder, I would say, because they are ones that you have to memorize. Top 200 drugs, the brand, generic, and the classification for those drugs. Really important stuff that we have. Like, you obviously need to know your medications in order to do that. So it's really important, but I do find that sometimes, it is one of the harder courses, right? Okay, thank you so much, Sol. So we have our semester 1 courses. So I'm going to go into each one of these, but just like a brief aspect. So we have AMP1 and AMP2, which we'll talk about in a second. And it's just an introduction to anatomy and physiology. But this is why you do need some of your sciences like the biology in order to get into the program. Communications for healthcare professionals is another one that you guys will have. Introduction to pharmacy practice is kind of like an introduction of everything in pharmacy. So we talk about the business side of it, how money is made in the pharmacy because it is still a business, and some of the laws that you need to know, and just like a general overview about pharmacy practice in general. Pharmacy math is one of the math courses that we have. We do have two. So this is a very basic introduction to it. Now, I would say that this pharmacy math is about a grade 6 level math. And it's funny because people think that, and then they're like, oh, that's going to be easy. But it's all the fractions and the rounding and all of those things, which are really important when it comes down to it, because we really need to make sure that we know how to round when we're dealing with our patients' medications. Pharmacy products is the one that I was talking to you about when we do the top 200 drugs. So in this one, you do know your brand generic classification for the top 200 drugs, and we look at many over-the-counter medications as well, and you will learn about all of those. Professionalism in pharmacy is obviously quite important. So that one is professionalism when it comes to working in pharmacy, our code of ethics, our laws, all of that stuff. We do go into many case studies. And then we have an introduction to Indigenous studies. So what you will see when we go through this is that our program, everybody has to take this introduction to Indigenous studies, which is classified as an INDG 49. But if you take one more course, you do get your Indigenous designation, which is really cool that we have that option for our students, and it looks really good on your resume, and lots of information that you'll get from that. I've learned so much just from my students and some background information that I've looked at as well. We can go to the next one, Saul. Thank you. So some of the important notes that we have for semester 1 is that pharmacy math and pharmacy products are both mandatory. So in order to progress as a full-time student into semester 2, you do have to be successful in these. That means that you wouldn't be able to be full-time going into semester 2 without them. The reason for this is that math and the medications are like the most important things in pharmacy, right? Like we can't be giving out the wrong medications to our students or the wrong doses. So math and the meds are so important that we did make it mandatory in order to progress as a full-time student into semester 2. I do get lots of emails on what hybrid means for our program. So what that means is that most of our seminars, all of our lectures are online, and we do use a platform like WebEx, which is why it's so bad that I just struggled getting that on there. But we do have WebEx for all of our courses that are lectures. So you would be attending online. All of the labs, though, will be in person. So every lab is in person. The nice thing about that is that there are days where you're just fully online, so you can be at home, learning in your pajamas and relaxing and on your computer. But then those in-class ones, you can come into lab and do all of your hands-on learning. We're going to move on to semester 2. So semester 2, we have another anatomy and physiology. We have another math course, so our applied pharmaceutical. So this course, the other one was just like learning the concepts. And then Math 107 is really putting those into pharmacy math. So applying it and looking at prescriptions and seeing how we work out dosages and patient-specific stuff. So it's really about taking all of the fundamentals that we learned in Math 106 in semester 1 and really applying it into semester 2. Concepts in Healthcare is a course that many healthcare professionals do take, and it's where you learn about other professionals and what they do. And it's really important to know what other healthcare professionals do when you're working with a patient to make sure that they are getting their patient-centered care and that everybody's kind of like holding up their end, or where to turn if maybe they need help with something. We have Pharmacology 1. So this introduces you to the medications, but in a different light. So not just memorizing what their brand generic classification are, what does that classification mean? So when I say indication for use or classification, what does that mean? What does it do in your body? How does these drugs work? So that's why this course is really important as well. Pharmacy Software Fundamentals is a fun one because this is where you actually put through your prescriptions. So we use a computer system called Kroll. You do learn about another system as well, but you will be using Kroll. And that's when you would be putting through your prescriptions, processing them, reading doctor's handwriting, which everybody always loves to do because it's so easy. And applying all of those medications that you just learned about, but now onto prescriptions and for patients. Safe medication practices is exactly what it sounds like. It is me telling you all of the ins and outs. Well, me, typically I teach this course. And what a root cause analysis is, what happens if a mistake happens, what you have to report, all of that stuff, and just like safe medication handling, all kinds of information in there. Standards of practice and legislation is all of our rules and legislation for pharmacy. So there are lots, obviously. So we are working with medications. So after you graduate, which we will talk about in a little bit, you do have to do a jurisprudence exam, which is you doing all of these laws and stuff like that and having to know them. And then it's basically an MCQ on that. So this course is really just preparing you for that exam and making sure that you know all of the rules, the laws and legislation for pharmacy. And Gen Ed. We actually have 2 Gen Eds in our program. So we do keep one in semester 2. And sometimes people have already taken another course and sometimes they can transfer over. But you do have to take a general elective course in semester 2 and another one in semester 4. There's some important notes on semester 2 on the next slide. These ones are that the math is also mandatory pass in order to progress as a full-time student in semester 3. Again, that is because of how important it is for the math aspect in order to get into semester 2. The majority of your courses are prerequisites for semester 3. So being successful in these courses is really important. There's lots of supports at Fleming College that can help you be successful, and your teachers are really there to help you. So coming to class, being prepared. I love that Fleming College always has workshops for everybody to do calendars to keep themselves up to date. And I really, really do tell my students all the time how important it is. Go and get your calendar, make your calendar because it's really important. Most students who take the time to make sure that they have everything organized and know when everything's due really don't have a problem moving in to all of the semesters. So you are going to start looking at your non-academic requirements in semester 2. That's okay, Sol. And again, all of the courses are hybrid. We can go on to semester 3. Thank you. So we do have clinical patho for pharmacy technicians. So this takes both of our A&P courses plus our pharmacology courses, and it applies it to pathology for pharmacy technicians. So this isn't an A&P that is across the board with all healthcare professionals. This is one that is specific to pharmacy technicians. We have comprehensive exams preparation skills. So in fourth semester, you will see that we do have a comprehensive exam course. And that is because after you complete this course, in order to become a registered pharmacy technician, there are exams that you do have to complete after. This comprehensive exam preparation does prepare you for the other course and then in turn for those exams. It teaches you what the exams look like, what to expect, like some ideas. Of course, we can't tell you everything that's on those exams, but it will give you an idea of what to expect when you go to actually do those exams after you graduate. Dispensing retail. So when you hear us talk about community or retail, those are those pharmacies that are like on every corner in whatever town or city that you live in. Those ones are called retail pharmacies. So this dispensing course is us teaching you how to dispense. So you'll see in the pictures that we have later on in the presentation, we have a medication wall. You'll be processing your prescriptions, going to pick up the medication, counting it, putting it in the vial, labeling it, all the fun stuff. So that's that course. Pharmacology 2 is getting into more medications. It's another aspect of pharmacology. So we do have our 1 and 2, but it just gets into it a little bit more in depth. Drug distribution is a course where we do talk about drug distribution as a whole. So that's retail and hospital, a little bit of long-term care. It kind of introduces you to all of the aspects that you will see in pharmacy and how the drug distribution system works. Field prep is a fun one because it's getting you ready for your placement. So that's where you do your resume, cover letters, interview skills, all of those things. Introduction to sterile preparation. So this is our introduction sterile course. So it's sterile compounding, like I talked about at the beginning. And that is what they do in hospitals. Okay, so this is an introduction to that course because we do have another one in fourth semester as well. And then field placement. Everybody's fun part is actually going on placement, working in a pharmacy for 200 hours. And this would be in a retail setting. You can go on to the next one. So some of the notes that I have here are that a lot of them are prerequisites for semester 4. So being successful is really important. Again, all third semester courses are a prerequisite for your placement in third semester. So again, very important to be successful. Your NARS, which we'll talk about in a second, if you don't know what your non-academic requirements are. And again, all of the courses are hybrid, in-class, etc. I'm going to semester 4 now. So our semester 4 courses are compounding. This one's my favorite. So compounding is like my little baby. I love compounding. So this is where we do cream to powder mixtures, mix them all up for patient-specific compounds. And like I said, we have lollipops. We can do all kinds of stuff, really. We have trophies, lozenges, and you're basically making it so you could take like a tablet and make it into a lollipop so that it's easier for, say, a child to take, right? So it's really cool to learn how to do all of that. Comprehensive exam is what I was just talking about, where you get ready for your exams that you would do after your graduation. And it's kind of like it is a comprehensive of the entire program that you've already completed by now or getting close to it. Dispensing hospital, again, is close to our dispensing retail. So this is how you dispense in a hospital setting. So we do have a tabletop packager, we have an ADU, we have a pick wall, we have brand new labs. So our labs are really up to date, and it's the students, we're having some really great feedback on the students with the new labs for these courses. Long-term care pharmacy is showing you how medications are given out and provided to long-term care facilities in Ontario. We have field prep 2, which is basically getting you ready for your field prep or your placement in semester 4. Sterile preparations is the second to the introduction of the sterile preparations, where you will be manipulating with the vials, doing the TPN math, TPNs, all of those kind of things. So sterile compounding. And this is where we use those hoods that I'm going to show you in a bit in the pictures. Field placement 2. So this is an institutional pharmacy. So this is where you will do 160 hours in a hospital. The hospitals can be all over. So we are always open to see where you would like to go. And we basically put out a survey to see your top 3. And then our placement office tries to put you into one of those. And again, like I said, semester 4, we do need another gen ed that may or may not be transferred. So all semester 4 courses are prerequisites in order to go on placement in semester 4. And then again, all of the courses are hybrid. We use in class and online. All right, so how do placement work? So we did talk about this a little bit. So our retail or community placement is 200 hours. 40 hours will be done before your week 12. So basically what happens is you go to class for weeks 1 to 11. And that's when you're on campus doing labs or online doing that. And then your weeks 12 to 15, you are 40 hours a week in a pharmacy and completing your 200 hours working in a pharmacy full time. So a lot of students love that because say they were coming to campus to live here, then they can go back home where they want to get a job and hopefully get into a pharmacy there where they can complete their placement. And then it would be our winter break. Our institutional, which is our hospital or long-term care facility, this one is 160 hours in your 4th semester. And again, we will try to get you into your top 3. It is harder to get into a hospital just because there's less of them, right? So we do try to get everybody, where they want to go or what area you would like to be in. And we use surveys in order to see where everybody wants to go. So we have these things called non-academic requirements. So these are the NARs. These are what you need to have in order to go on placement. I think there is a slide that goes over those. We can go on to the next one there. So here are the NARs. So you do need to complete them and continue to have them for the entire program. So you go on placement in 3rd and 4th semester. Sometimes something might have expired in that time, so you have to make sure that you're keeping up with the dates. We do have this thing called Synergy, which does email you and tell you when those dates are coming up. So you just have to watch your email and you can do that. Those that you will need is a vulnerable sector check. So you get those through the police station. You'll get all of the information that you need to in the program. This is just a general overview. Your immunization forms, you'll have to have those signed by a healthcare professional. A mask fit within 2 years. Again, you'll get information on what that is in the program. An annual TB test, a WSIB student letter. Most hospitals are asking for the COVID vaccine with a 2-dose minimum. If that will be an issue, you can always reach out to me and we can see what we can do with that. There are some hospitals that are not asking for it, but probably 98% of them are. So I just want to make everybody well aware of that. But just in case you don't have your flu shot or your COVID vaccine, it doesn't mean that you cannot enter the program. Okay, so we will just have to find you that 2%. The international students will have to provide a work permit as well. Okay, so the technology requirements, so I will go over this again in the program, but it's just this is what you need for your laptops. I do like to tell everybody that because a lot of people do pick up Chromebooks because they are one of the least expensive ones, but it's really important to have a laptop. MacBooks, they have said, are not recommended just because there's workarounds that we have to do. But if you have a MacBook, I'm not going to tell you that you need to go get a different laptop because I know how much they are. But the other laptops are just a little bit easier. I talked about that pharmacy software Kroll that we have. We do put those on your computers where you can work from home. So that's why it's important to have the technology requirements. Really important to have a laptop. So Kroll software, we've already talked about. This is where you process prescriptions, you read your monographs, you maintain patient profiles and everything. You will learn all about that in semester 2 in our software course. We do have uniforms. So you do have a scrub top that is available from the campus store. You do get one of them included in your tuition. So it's just a plain black scrub top with Fleming College Pharmacy Technician student on it. And like I said, you'll pick up the one that you get. If you wanted an extra one, I think they're around $30. So you can always buy one. There is a program jacket that we do have as an optional that you can buy at the campus store. There's a hoodie that you can buy at the campus store. Both of those are optional. We have black scrub pants that you should be wearing for your uniform as well. You can get those from anywhere though. We don't say that there's a specific spot that you need to get those. And your uniform is required beginning in week 3 of semester 1. So by that time, it's past day 10. You can go get your scrub top. You should be able to get your pants. And then it is important that you're wearing your uniform every time that you come into the lab. So our labs, just like I just mentioned, they're recently updated. It's only been a couple years that we've had them. We do have a retail lab and a hospital lab. So I have some pictures for you. This is our retail lab. So as you can see, we have a cool drug wall. In here, it's brand generic. There's liquids, there's inhalers, there's everything that you can think of, creams. So we really try to show you what it would look like in a pharmacy. Some of you may have worked in a pharmacy before, and that's why you're interested in the program. Maybe, maybe not. Or you've been to Walmart, Shoppers Drug Mart, etc., where you look and you see the shelves with all the medications on them. And that's really what we wanted to make this look like. We can go on to the next one. Again, this is another picture of our drop-off. We do have an updated lab, which means that we have TVs around our lab, which is really cool. So whenever I'm showing you something at the front that you would have just seen where the computers were, we do have cameras that can follow me around and that can zoom in all around the classroom. And then it can be on all of the 3 TVs in the lab, which is really cool because then there's no blind spots. You can see anything and it's right up on the TVs for you to see. The picture that we have in here, you can see the TV, but under that is our compounding stations. So in those stations, in the drawers that you see, are all of the stuff that you would need for our compounding course, all of the chemicals that you would need, your weigh paper, like the scales are out. Every single person in the lab has their own station. So there's 10 stations when you're compounding, and the labs are split up that you have your own station, you have your own everything. So there's no waiting periods. It's like the way that this new lab is set up, it's just perfect for compounding. You have your full station and everything that you need. We can go on to the next one. So this is our sinks and where we dry stuff up. So we have 2 double sinks for you to wash everything after you're compounding in the lab. You can see that there's computer stations as well. So there's more compounding stations at the back where you can see what looked similar to the other one. But then in the middle, where all those chairs are and the computers, that's where we actually have 30 stations for students. So every student who comes in, they have their own computer, they have their own dispensing tray and everything that they have on there. And yeah, so it's whenever you're dispensing meds, you can just sit down and have your own computer and process all of your prescriptions, count them all, and have your own space. This is our patient counsel area. So when we do any role play and you would be a pharmacy technician showing a device for a patient, then this is the area that you could go into. We do have computers there as well, so that if you need to look up patient profiles when we're role playing, then everything is there. And you can see our abundance of baskets, because when you are dispensing in a pharmacy, you count your meds, you put it in the vial, and then you put it in a basket, and that's how it's all checked. Our next one. Now we get into the hospital lab. So this right here that you see is a hood. So when you are doing certain things in the hospital, you need a sterile environment. So that means that you need the air to be moving in certain ways. So we have this hood is just one that the teachers practice on and show the students, but we do have an entire clean room as well. And then all those baskets at the back are called the pick wall. That's what I had mentioned earlier. So when you're dispensing, you can go up and get the meds from the pick wall in order to dispense them for the patients. Another picture of the pick wall. That red right here with like the little orange is called a tabletop packager. So this is where we make all of our unit dose. So it actually works, and you would be making unit dose systems for patient. Well, it would go into an ADU on the floors in a hospital and then given to a patient. And this is another picture of the lab setup and where everybody would be sitting, the tables, etc. This is where we get into our clean room. So when I say clean room, it means that you have to be clean in order to maintain a sterile environment. So when you walk into this with the sinks, you're going to put all of your, like it's called garb up. So basically you're washing your hands, putting on your gloves. You would need a hospital coat on, you need your mask, your everything to make sure that you are completely clean and sterile before you walk through those doors. When you walk through the doors, you will see that you can see 3 of our hoods right now in this picture, and we do have cameras so that we can record as well. The nice thing about that is that if we're recording, you can actually look back to see like where you maybe went wrong or how amazing you did, and you can look at the way that you were working in there. So this is called our clean room and our ante room for our hospital lab. Okay, so this is my email. So again, it's katieroy@flemingcollege.ca. If you have general inquiries, you can go to the Ask Us as well. If you would like to come and see it on campus, I'm more than willing to show you. There is also tours, and we do have open house coming in April as well. I think that's everything. So thank you.
Oh, I'm joining as well.
Sorry.
Thank you so much, Katie. Oh yeah,
No
sorry, go ahead.
problem.
All right, perfect. Yeah, thank you so much, Katie. That was great. And again, apologies for all the tech issues we had today. Yeah, that was great. Again, our contact information is there if you guys need to reach out later. We'll be happy to answer any questions. Again, if you have any questions right now, feel free to leave it in the chat box. Either me or Katie can answer right now. And yeah.
Yeah, so usually it's about 2 weeks before your start date that you would typically see your schedule. So it would be late August, middle of August, yeah.
Okay, perfect. Do you have any other questions? Yes, so also, yeah, we put in the chat our general inbox. This is for recruitment. Again, if you have any general inquiries, feel free to reach out. If you're looking for like more specific details, yeah, feel free to reach out to Katie. She will be your best contact. And then, yeah, any transportation from GTA to the campus. So for public transportation, unfortunately, the train actually goes up until Oshawa, as far as I know, and then there would be a bus coming from Oshawa to Peterborough. So yeah, unfortunately, there's no direct train to Peterborough. Hopefully that answered the question. But also, I would like to add, so for all of our full-time students, they do get a bus pass for the city of Peterborough included in their tuition. And again, if they're living locally, that would be a great option. But yeah, if you're asking from like Toronto to here, then for public transportation, it will go up to Oshawa, and then from Oshawa to Peterborough would be a bus. Sorry, Tom, I'm not sure. You said you have applied, but you need updating on how do I do that? Sorry, what do you mean by updating? What are you trying to update?
Here, I mean, I think Tom means upgrading. So
Oh,
getting
okay.
either
That
your
makes sense.
chemistry or English or math. I'm just going to
Okay.
send our academic upgrading email in the chat here, aupeterborough@flemingcollege.ca. Usually we suggest doing your academic upgrading towards near the campus that you're going to be attending. So if you email aupeterborough@flemingcollege.ca, one of our great student advisors will set you up with that and support you through that process.
I can speak to Shauna's. We did have a January intake, which was going to be accelerated. We did not run that in January. So basically what that would have meant is that you would have had courses from in the winter semester and then the spring semester and then fall and winter. So there would have been no break. But that cohort did not run. So the only difference is that you get the summer off. So it's still almost 2 years anyways. There's just no summer break. With the fall intake, we do have the summer break, but no, there is no summer courses at this point, Graham.
Okay, perfect. We'll give it a few more minutes in case anyone else have any questions.
Yes, you do. So you would come in September for first semester. Winter would be your second semester, and then you would be off for the summer. Come back in the fall for third semester, and then winter would be fourth semester.
So for Montana, so who's the best to speak? Oh, sorry. About my transcript, I have applied, but I received an email from admissions saying I'm missing requirements, but I believe I have all requirements needed. So so I would say that would be our admissions team. If you know that you have all the admission requirements, I would be advising all the students to reach out to admissions directly. I would leave their email address in the chat as well. So I would reach out to them directly, and they can review that for you. Just a second, let me leave that here. And that's admissions@flemingcollege.ca. And then with the need for upgrading, would I be able to still get in for the fall if I did the upgrading now? So so the answer to that is that you can do upgrading and then apply also for the course. As long as you have the required credits by the start of the program, you should be okay. So I would recommend reaching out to our academic upgrading department as soon as you can. And then they will usually take a skills marker from you first, and then based on your test results, they can let you know how long approximately your upgrading is going to take, and you can make a better decision to see if that will, suit the timeline. So like, let's say, for example, if you're starting in September and they'll get back to you and say like you most likely will have all the required credits by September, then yes, you can apply. And then usually in those cases, you will get like a conditional offer based on the condition that you have all the required credits by the start date. So yes, that is possible. So you don't have to wait until you finish upgrading before you apply. Hope that answers the question. And then
I
what
can
is
take
the
the
okay, yeah. I'll leave that to you.
The passing rate for the licensing exam is pretty high. It does change every year, and every school is slightly different. The way that I kind of explain it to the students is that we really are setting you up in 2 years for those exams and for you to be successful. So if you come to class, you do the assignments, you listen, all of all of that, you should have no problem with the licensing exams. I would say high 80s is typically what we would see for the passing rate of them, which is pretty good. But again, every year is slightly different because it depends on how many students you have and all of that as well.
I think I'll take the next one.
Yep.
Ruala. I don't know if you wanna send us an email. You can use admissions. You can use international if I'm guessing you are international student. And we can go over your options for the English requirement. But if you completed the ESL program at a public institution like Sheridan, we can look at that diploma and transcripts as well.
Thanks, Sol. So Montana, like regarding the email to admissions,
Fermina,
sorry, go ahead.
I'll chat with Montana. I'll reach out to you separately. I've just got your thank you for attending, because gets our attention, obviously. So I'll reach out to you with some next steps, and I've got your account pulled up here. So I'll support you through that. Thank you.
So the licensing every year to stay certified. So in order to be registered, there is a licensing every single year. So as a pharmacy technician, it kind of changes, to be honest. It was this year is $683, and then you do have to have insurance, but that's for the year. But just like every registered healthcare professional, we all have fees.
So Jenna, regarding you as well, you can also directly email Matt, or I will also leave my email address here, so you can reach out to me or Matt, and we'll be able to look into it.
I considered passing percent for a licensing exam. I can take that one. It's kind of hard to explain, but we do get into it in the program. Basically, what happens is it depends on the last time that the people wrote the exam. Okay, so it is we try to have a 70% pass on all of our important big exams in the course, because it tends to be around that average, but sometimes it could be 73, sometimes it could be 68. So it really it kind of depends, and they have their own way of figuring that out. So there's no way of me actually telling you what the percentage is. But I would say if you were in and around that 70%, because the problem is that there's some questions that mean more than others, right? So it's kind of hard to answer that question. But in the program, we do go through all of the blueprints and make sure that you are well aware of what you're walking into. Prospects. Oh, job prospects. Flooded as in looking with pharmacy technicians, or I have, okay. So I'm receiving tons of emails all the time for jobs. Um, Toronto is always going to have more opportunity because it's just like a bigger city, right? So um, the further you go out, they will be looking a little bit more. There are tons of incentives that are out. I've seen, them looking at, paying for housing and large incentives just to sign on. So yeah, there would be more in Toronto, but there's definitely jobs out there. We cannot fill all of the jobs that are there for pharmacy technicians. Most of our students actually get hired out of placements.
Sorry, I just wanted to jump in. Well, this is where our teams come together. And thank you for clarifying you're not international, but you have credentials from overseas. So we work together in helping students that have been trained abroad and then navigating the English requirement piece.
And yes, a long-term care facility would be more, it would be a long-term care facility similar to a nursing home rather than a hospital. Yes.
All right, well, we have 1 more minute. Any other questions?
Please make sure to reach out if you guys have any after you are. I'm going to put my email in here one more time just so that it's kind of at the end there.
We have 1 more question. I'll leave it up to Katie.
I can take that, but I don't know that I can answer it for you. I don't know why the nursing exam is 350 and ours is almost 3,000. We have a 3-part, so it is possibly a larger. The other thing is that we are directly working with dispensing and giving out the meds. It is a interactive exam, but unfortunately, I don't know that I can fully tell you why. It is quite a big difference, but I can tell you that I love my job and that it is rewarding. And I know it seems like it's a daunting amount, but it really is the most rewarding job. Thank you for coming.
Perfect. I think that wraps everything up nicely, and I learned lots as well, especially I think that investment, that $3,000 is, it really shows your commitment, right? And what you were saying, Katie, about loving your job, and I think that's that hurdle a little bit, but really shows that commitment to people's health, and with an aging population, definitely a needed role to support those individuals. Thank you, everybody, for attending. Enjoy the rest of your evening. Again, if you need any support, ask us at flemingcollege.ca, or the myriad of emails that ended up in the chat. We're always here to help. And Montana and Jenna, I'll reach out to you guys individually to support you through that process. Okay, bye for now.
Okay. Thank you, everyone. Have a good night.
Thanks for joining. Thank you.
Bye.